My name is Sam Meisler, and I'm a small animal veterinarian. In this segment, let's talk about dog eye infections. Dogs can get a variety of conditions in their eye that cause an infection, and the most common one is actually a scratch or an ulcer on the cornea. And what we see with these things is they're usually started by running through grass or rubbing the eye and causing a scratch, or anything, dust getting in the eye and then a dog rubbing its eye and causing a scratch, resulting in a corneal ulcer, the ulcer in the surface of the eyeball. Bacteria get in there and cause an infection, and then we've got a real problem. And these can be emergencies. If your dog has what you think is an eye problem, this is something that needs to be seen by a veterinarian right away. Now, of course, there are other causes of infection in the eye, some bacteria. We don't see a lot of what we call pink eye in people, where we have a contagious situation from dog to dog. Some upper respiratory diseases may cause some inflammation in the tissues around the eye, like in the eyelids and that sort of thing. Primarily, we see infections caused by a scratch in the cornea. And again, this is an emergency. This is something where you need to go to your veterinarian right away. What they'll want to do is do a fluorescein stain. What they're doing is they're going to put some drops in the eye of your dog along the surface, just some eye drops. They'll bind to anywhere that has disruption in the corneal surface. So if you have a tiny little scratch in there that's not always visible with just the ophthalmoscope or the little device that your doctor or your veterinarian will use to look in your dog's eyes, it's not always visible. So this substance will bind to those areas and turn them green, and they'll be much easier to see with an ophthalmoscope for your veterinarian. So that's a fluorescein stain. That's something that will undoubtedly be done at your veterinary hospital when you go in. If there is a corneal ulcer or a scratch or abrasion in the surface of the eyeball, then it's treated a lot differently than if there's just inflammation or infection around the tissues. And that's why we need to do a fluorescein stain. Because one, you'll just treat with antibiotics or appropriate anti-inflammatory. The other, the corneal ulcer, you do not want to put a substance like a steroid in the eye, and you want to be paying a lot more attention to it, and your veterinarian's going to want you to come back for frequent rechecks until it's all healed. Either condition, usually a dog eye infection that's resulted from a corneal ulcer, will be something that's going to be treated for a while, watched fairly carefully. There may be topical eye medications that you put on, sometimes some medications to take orally. We're much more conscious of our pet's comfort, and there may be some anti-inflammatories that your dog takes orally as a tablet just to make it more comfortable. But again, dog eye infections or anything that's causing your dog to have symptoms of an eye infection, like squinting, rubbing its eye, holding it shut, swelling or anything like that, any grayness on the corneal surface, all those things mean you need to take your dog to a veterinarian fairly quickly and have it diagnosed.